Hi, everybody. We are talking about PCOS, and in this series, last week we covered what exactly is PCOS, how to identify it, what are the common symptoms, like if a person is having irregular periods, acne, or hair fall, then there are certain alarming areas where instead of going to the dermatologist, it is better we go to a gynec and make sure it is identified. Soumya, would you like to just recap what we talked in one or two lines, and then we can go forward with how to manage PCOS with a healthy diet and lifestyle changes?
See, it is as it is common, like, see, almost 1 in 5 women are being affected with PCOS. So once you are identifying with these symptoms, then you need to visit a gynecologist and get it tested.
Yeah.
So since it is increasing at an alarming rate, the earlier management and the diagnosis from a gynecologist is better, because see, the more earlier the intervention is, the better the outcome will be. Or
So we want the girls to get it tested and get it diagnosed at an age where they are going still in schools and colleges. The awareness has to be at a place where it is diagnosed at the earliest stage. Let's say we'll consider one of the cases which we recently had of one teenage girl. She is in 11th standard and she has some stress issues. She had acne and very recently she was suffering from obesity issues. She had a BMI of around 27, worked out on different fat diets and all, got it reduced, and then again gained weight. And then her acne and hair fall was increasing. So, all those reasons why finally she got diagnosed with PCOS. So, would you like to describe that? Yeah.
mainly PCOS, along with the medication, lifestyle modification is required, especially diet. So then we started with the elimination diet. PCOS, there are multiple causes and the exact cause is not known. So the elimination diet included, like, we eliminated gluten, dairy and sugar. Then secondly, we did the detoxification. So the all the toxins from the body were eliminated. And then even we said no to cosmetics. She was not allowed to use cosmetics after that. And then slowly we introduced her into exercise, like basic exercise, what she could do, like for 30 minutes of walk and at home, like aerobics kind. Then a balanced diet was introduced, and we also counseled her mother, like how all these diet changes can impact her health, like PCOS, especially hormone balance. The target for that was including vegetables which improved the insulin resistance, like ivy gourd and bittermelon and lauki, and lot of green leafy vegetables like spinach, cabbage, kale, and even broccoli. Like, these also help in reducing inflammation. Like, see, since the cyst is there, this cyst happens mainly due to inflammation in the body. So all these anti-inflammatory foods help to reduce the inflammation. Then next is the fruits. See, your fruits were like low sugar content fruits had to be given. So
Uh,
we introduced.
Her mother had to be counseled because she was not ready to eliminate a lot of things, in the sense when we asked her to get rid of all the plastic, all the boxes, try cooking on cast iron and all, remove the aluminium. But we have to understand that if you're cooking in, let's say, aluminium and non-stick tawas and everything, ultimately it is harming us. So all those heavy metals and toxins going in the body are going to harm. So, as Dr. Soumya mentioned, we had to get a lot of things out of her kitchen, which is a bit difficult, but her mother cooperated a lot afterwards when she understood the kind of problems that she will face in long term. It is just not about acne, it is just not about the looks and the feel. It is not about obesity, it is not overweight. Anybody who is overweight can also look very beautiful. So when we support every size and every person, but then side by side when we say that weight loss has to happen, There is a reason for that, because as Dr. Soumya mentioned, that insulin resistance, whenever we try to lose around 10%, right? Around 10% of body weight when we lose, the insulin resistance is automatically reduced a lot. Your body starts to respond to that hormone, and then it is better managed, and then automatically at the end of the day weight loss will happen. So emphasis should be on good food rather than on anything and everything and trying fad diets, like just being on juices or just being on a particular keto diet or something without any guidance. It is going to harm you more, because you will lose, let's say, 10 kgs in a month or 2 months, but then that 10 kgs will bounce back with more hormonal imbalance, as it was happening in her case. And her insulin resistance was getting increased every time. And her estrogen and progesterone, when we're talking about the female hormones, when we are measuring the FSH, when we are doing that, and you just put any junk into your body, or when you are just removing the complete carbohydrates from your diet, or when you're removing, let's say, you're going on a very high fat diet, or going on a very uh, only on proteins, you have to have a balance of everything. You have to have a balance of micronutrients, trace elements, everything. There is a science behind all that. It includes the whole chain. Yeah, Dr. Soumya, we introduced seed cycle in her diet. So would you like to explain that?
See, mainly the cycle, menstrual cycle includes phases, that is phase one and phase two. Phase one will be the follicular phase, that is where the estrogen is more, and second is the luteal phase, that is where the progesterone boost is required. So in the first phase, we included pumpkin seed and flax seeds for her, where it increases the estrogen. So that helps in the cycle, the follicles which is required gets prepared. Then the second is the lutein phase, where progesterone is required. So here we made her take sunflower and sesame seeds. So that helps in the regular menstrual cycle. People just take the seeds whenever they feel like, but it is always better not to have it with any meal. It is usually it's better they consume as a snack, on an empty stomach, so that the better absorption of nutrients will be there.
So whenever we are talking about food, we need to talk about the bioavailability of the food. It's not just that we have anything and everything. It's a very good example of seeds, as you mentioned that there has to be a time for everything. We were able to help her totally eliminate sugar from her diet, because talk about anything but sugar ultimately in form of jaggery or honey or anything is sugar, and that is inflammatory, that is not good for the body, especially when we talk about insulin resistance and inflammation. So it is better that we avoid it completely rather than experimenting and trying it once in a month, or a very special occasion is a different thing. But in general, we should really not substitute it with honey or jaggery or something else.
See, glycemic index mainly is like how fast your sugar rises following a particular meal. So that way, low glycemic index food helps you like for the slow rise in the blood sugar. Because what happens is when there is sudden rise in the blood sugar, the insulin increases. When the insulin level increases, that impacts your hormonal balance, especially your female hormones, that is estrogen, progesterone, and male hormones also increases. See, mainly low glycemic index food includes like barley and especially these proteins like legumes, chickpeas, lentils. All these can be replaced with other refined carbohydrates.
Sugar and glucose is 100, which is the max, and then that is the comparison from which we derive all the other food. So barley has around 24 to 28. Then chickpeas are, as we mentioned, are very good. Legumes, any of the legumes. So for example, I come to you as a mother, okay, and I have to cook for my daughter who's suffering from PCOS. what should be taken into consideration from morning to night? We'll just take one day example. And because everybody, we need to make sure that everybody is different. Every person's blood reports, in the sense the calcium, the B12, the D3 levels, everything is going to be different. But this we are talking about in general, where we are considering that most of their vitamins, minerals, and everything is in, in balance.
See,
So if
morning you can start with like soaked fenugreek water. Like, see, fenugreek mainly helps in improving the insulin resistance. So you
right,
can start with that, and along with that, you can also take garlic cloves. That also helps in balancing blood sugars and cholesterol levels.
it's a bit
Then,
difficult to have, but then it is very, very, very helpful,
yeah,
beneficial.
helpful.
So what I do normally is I just put the garlic clove in the mouth and just take water, because when you crush it at that time, that the chemical that is released is the most helpful. Instead of cooking it, cooking most majority of the time cooking destroys it. So
This
taking
is
raw fresh garlic is best. If you can do it, it's going to really help. Otherwise, I guess the option could be chutneys or something where it is, not cooked, but it is crushed in a
true.
fresh form. Yeah. But as you mentioned, methi, fenugreek plus garlic in the morning. Yeah, please.
Yeah. Then you can also include cinnamon, soaked cinnamon in water, the previously soaked. That also can be included because cinnamon is very good, and it also improves the insulin resistance and brings down your blood sugar and balances insulin level. Then second is, see, for breakfast you can include barley khichdi, or you can also have these soaked lobia, or these legumes like lentil salad.
You want
So
to
it's
get
better they avoid that because paneer is again dairy. Dairy is more of inflammatory, and it also imbalances the estrogen level. So
yeah.
it's better to avoid dairy. Then for snacks at around 12 o'clock, you can include fruits like avocado and kiwi, because avocado is low sugar content, and kiwi, it is vitamin C rich, and even you can include orange. So that can be taken at around 12 o'clock. Then for afternoon, you can include mm, emma wheat roti with vegetable curry, or you can also have green vegetable salad along with that. Then for tea, you can include herbal teas, which are very good because it is again dairy free, and especially herbs like shatavari, ashoka, lodra, and even mint. They are all very good, and they also help in. See, shatavari is well known for its balancing female hormones
Yeah.
in ancient some ancient Ayurveda,
Even
and
ours
then you.
is there, it's available on Amazon. And especially the best part about herbal teas is no milk and no sugar. You don't need anything there. The taste is
Yes.
also very good. Yeah.
Yes. And then for night, it's better you always have, you can have soup, like vegetable soup. Especially there are vegetables which reduces inflammation. That is beetroot, broccoli, cabbage. All this helps in reducing inflammation. So you can make one of these soup and
The stress
consume
level.
it.
Generally, what we have seen is in this stress levels and anxiety is very common, and especially when we talk about teenage girls, they have their studies, they have their other social busy schedule and everything, and they tend to sleep very late. They have to get up early. They have a very stressful life compared to what earlier it used to be. So how would you suggest them to manage that?
I agree that these teenage girls, they are under stress because of their studies and all that, and that is one of the reason for their acne. So they can reduce their stress by consuming tea. Like, see, since they are into dairy free, they can have herbal teas with chamomile, mint, and even licorice. Licorice is very good for PCOS also. So, and along with that, even there are ancient herbal teas which includes jatamansi also. So they can consume that, and even pista is very good as it releases melatonin. So they can have 4 to 5 pistas in the night before going to sleep. So that helps managing stress and sleep.
Nutmeg also, little bit of nutmeg.
Acne, yes.
Yeah, we have a very good combination for sleep. But nutmeg, pista, and arnindra, and all these things combined together can help in stress management. Along with that, lifestyle changes of bringing in some meditation and uh,
Yoga,
yeah,
or
yoga.
if, yeah, exercise is very important. Lifestyle modification, which has to be done in PCOS.
And since we're avoiding dairy, we're not going to add curd to the diet. We will try to have, if we want, we can have almond milk to it, almond or cashew or walnut milk to the whole diet in between the whole day anyway, or coconut water, lemon water. All these will help in hydration. So when we are talking about eliminating dairy, what are we trying to substitute the calcium in this? Roti or morning chilas we can have with ragi. That will help in her calcium amount. Then sesame seeds, we can even sprinkle on food if she's not having it raw. Uh,
Yeah, we can
as
always mix with morning salads also.
Yeah, she should have it without food. She should have it as a snack. But if she's not having it, it's better to have it mixed in roti or in salad or in vegetables anyway. It has to go in. And all these things, if done, apart from the stress management infusions, teas, and the dry fruits that we talked about, all this, let's say she does it and she's able to do it for 3 4 months. What about the energy levels? What about if I'm removing the rice and the roti? All these things will take care of it. She won't go
Yeah,
deficient in anything, right?
no, no. Since we are putting her on balanced diet, see, we are giving her carbs, proteins, and fat, which is required. So I don't think she will have any energy deficient. And see, we are not replacing the whole meal with any fluids, only on liquid diet. So this will definitely help her to give her enough energy to maintain her daily activities.
I don't need to worry about her fatigue levels, or I don't need to worry about giving her extra sugar or anything anywhere to, boost her energy levels or something.
With all these, she will be more active and she'll have more energy. And she should, I want to add on is that she should get good sleep, like 6 to 8 hours sleep, along with the balanced diet. Definitely, it will help her to balance her hormone levels, and she'll have good amount of energy to carry on her daily activities.
So we talked about food. Apart from food, do you think any supplements will help? An extra addition of supplement will help in this?
See, as such, in PCOS, the vitamin D3 level will be low, would help in her hormone balance. Along with this, even omega-3 fatty acid, which is in fish oil, and even the flax seeds are good in omega-3 fatty acid. So we are replacing with seed cycle, but we have to do the blood test. Accordingly, we need to supplement uh, according to individual need.
We have seen in elderly, at least, especially in around 35 to 40 years females, we have seen magnesium deficiency, we have seen selenium deficiency, omega 3, as you mentioned, right? So, all these things in them we can easily supplement without doing a test because generally they are low in that. But in teenage, when we're talking about teenagers, then we need to see whether they really need it. But majority of the cases they have deficiency in that because if they are doing a fad diet or something, again coming back to the diet part where they have eaten a lot of junk or they have been doing crash diet courses and everything, then again they will be low in magnesium, copper, zinc, all these things. Once they start with the seeds and all, it will help. But as you mentioned, doing a blood test report will give the actual picture, and then supplementation will help. But then the person needs to talk to their dietitian or their gynecologist that these just remind them that these will help. So beyond food, the things that are going to help when we talked about this is good relationship with food, because when we see food as our enemy, that the way you eat, right, it will give a harmful effect to your body. Inflammation will be more when you're eating food with guilt or something. The first thing that is required is having a harmony with food, having the right food choices. But then, occasionally, once in a month, if you're eating cake or if you're eating an ice cream, it is okay. You should not really punish yourself for that. Stress management, better sleep, exercise, and very good nutritious food is going to help in overall management, right?
Yes.
Yeah.